for the session over a series of news conferences beginning today and continuing for the rest of the week. While these are priorities that we're talking about today, we hope and expect that they will turn out to be priorities for all four caucuses, and that there'll be broad bipartisan support on these issues because they are critically important for the people of the state of Connecticut. So that we want to make sure that we get them launched properly today by highlighting them. Some of them have already been discussed to some extent in the media, but of course we hope that these will not be partisan issues, and of course they're not specific to the Senate or necessarily to any one committee. But as we did last year, we thought it was important for us to lay out a list of priorities at the start of the session. So at this point, I will introduce our Majority Leader, Senator Bob Duff, for some introductory remarks, and then we'll talk about some of the specific items that we'll go through today. Bob?
Thank you, Senator Looney, and thanks for all your leadership on these issues. You've definitely helped make sure that many of these issues are bipartisan for sure and goes through both chambers. I'm here today because I wanted to just thank everyone for their work on these issues of healthcare, energy, and the environment. Whenever we look at rankings for the state of Connecticut, we always rank high in our healthcare. We rank high in social indices as regard to our families and the access to affordable healthcare. We want to make sure that in Connecticut we maintain that. But we also look to the new challenges that are before us, such as PFAS and other types of chemicals that may be in our water or other ways in which we can protect our constituents. So I'm just glad to be here. I thank Senator Looney for his leadership, and certainly the senators behind me who will be working on these issues as well for their leadership as we draft these concepts into what will be legislation going forward. Thank you.
Thank you, Bob. The first one I wanted to talk about is a bill that has been discussed to some extent publicly up to now, and that is our initiative regarding access and controlling the cost of insulin for diabetic patients. And we know that this is literally a matter of life and death for some, because while certain drugs can have their dosages adjusted, people may be running short, they can take less than the prescribed dose maybe for a certain period of time to spread it out. That kind of option and that kind of flexibility does not exist with insulin, which is a daily life and death drug that diabetics must have in the right amounts. What we have seen, especially since 2012, is a significant annual increase in the cost of insulin. And there's more and more concern now that the copays and the out-of-pocket costs are growing enormously to unaffortable levels, even for people who have insurance. So our bill, which is similar to those that have been passed already in 2 states, in Colorado and also in Illinois, although I believe the Illinois bill has not yet been signed, will cap insulin and insulin supplies costs at $100 per month per patient. And also, our bill takes into account, again, the emergency nature of access to insulin by providing a mechanism to make sure that people are able to get insulin in an emergency. In other words, if they're away from home, if they're not near the pharmacy where they have their prescription, to make sure there's no impediment to emergency access to insulin. We believe that this is something that will be broadly supported. It is something that I think that every family, to one extent or another, has had contact with either a family member or someone whom they know well, knowing exactly the impact and the need for insulin and the dependence on insulin for diabetic patients. So while there are many areas where the cost of prescription drugs have gone up, and we'll be talking about that in a more broad sense as well, the specific focus on insulin is paramount in our minds just because of the daily emergency potentially faced by people who are insulin dependent. At this point, I'd like to introduce Senator Matt Lesser, who is our chair of the Insurance and Real Estate Committee, who has taken the lead on so many consumer protection bills on access to health care and protection of consumers. In fact, I think what we've seen over the last several years is that the consumer protection issue has been one that has been front and center more often on healthcare issues than in almost any other. We've been concerned about access to services, about costs of insurance, about costs of prescription drugs. The bill we passed 2 years ago that was a national model, barring pharmacists from having gag orders imposed that prevented them from telling their customers that sometimes it may be cheaper to pay cash for a generic drug rather than put it through one's insurance. Every time we identify a new problem in terms of disadvantaging consumers, another one tends to arise, and they often tend to be in the field of healthcare and health insurance. So the Insurance and Real Estate Committee has been at the forefront of much of that, and I'd like to introduce our chair of that committee, Senator Matt Lesser.
Thank you, Senator Looney, and thank you for your leadership on health insurance issues, not just this year, but for many, many years. You've been a champion of these issues and have made Connecticut one of the healthiest states in the country. I think that is a direct result of the public policy choices that you have led on for many, many decades. So I'm grateful to stand with you and for your confidence in appointing me chair of this committee. The last year, 2019, was one of the most productive years in the legislature in decades. Under the leadership of our labor chair, Senator Kushner, we passed paid family medical leave, we raised the minimum wage. We got a lot of things done in the legislature, but the unfinished business of the last legislative session is the issue of health care. And when you look around the state of Connecticut, you hear from families, people are dealing with massive increases in the cost of healthcare. Small businesses in particular are being affected. And what we're hearing in particular are that even those folks who do have insurance, thanks to high deductibles and other restrictions on access to care, find their care increasingly out of reach. And so it's our intention to tackle those issues head on in this legislative session. Over the last few months, I've been working very closely with my co-chair, Representative Sean Scanlon, as well as our ranking member, Senator Kevin Kelly, with the governor's office, hoping to bring forward broad areas of consensus, areas where reform is possible, ways we can lower costs for families across the state. Families have waited long enough in Connecticut. This is the year for us finally to deliver on the message of reform. All of the issues on the table will help do that here in Connecticut. All of the bills being raised are ideas being offered. I think you'll hear very soon some productive announcements with the governor's office about specific steps that we're taking to make things better. But I want to highlight just a couple of important points that we're going to be focusing on. One is the issue of prescription drugs. Over the last few months, Representative Scanlon and I have been going around the state, listening to people in different parts of the state. We've worked with AARP. We have seen that the most significant cost driver in the cost of healthcare is the skyrocketing cost of prescription drugs. So we're going to be working together to roll out a number of reforms, looking at best practices around the country, including reforms that Governor Charlie Baker, a Republican, has been pushing just across the border in Massachusetts. But there is absolutely no reason why people should be paying the highest prescription drug prices in the world, and why other states are moving to tackle this crisis. We can't do that as well. And additionally, one other important public health measure that we are considering would allow people who are on their parents' dental plans and vision care plans to stay on those plans until the age of 26. That's something we were looking at last year. It ran out of time, but I'm confident we can make that happen this legislative session. Thank you.
Thank you, Senator Lesser, and thank you for your ongoing leadership on these issues that are so important, both in terms of issues related to health, but also issues related to the many points at which insurance coverage, insurance deductibles, insurance costs, insurance affordability are so directly intertwined with the quality of health care and access to health care. Next, I would like to introduce our chair of the Public Health Committee, Senator Mary Daughtry Abrams, to talk about some of the initiatives that that committee will be advancing this session. And again, that is a committee that has been one of our more progressive committees in the last several years in terms of consumer protection and protection of the broad-based public health. And Senator Abrams will talk to us about issues related to expanding patients' rights.
Thank you, Senator Looney. I'm so proud to stand here today with the Senate Democratic Caucus as we continue to strive to meet the needs of the citizens of Connecticut. And I greatly appreciate your leadership and Senator Duff's leadership in helping us meet these challenges. Sometimes it's hard to believe how far afield we've gone with healthcare. For instance, people who are lucky enough to have insurance in our current system, if they're prescribed a new medicine or treatment by their healthcare provider, they're not allowed to have a voice in the decision-making process of insurance companies until after that claim has already been denied. In relation to insurance company, a patient's really a consumer who should be entitled to participate in the system that they're paying for. Individuals need a voice, an opportunity to tell their story, in order to prevent any frustrating or unnecessary denials of medical care. Waiting to be given your voice puts one on the defensive, and a denial of care can't be a form of healthcare rationing, neither of which is conducive to one's health or well-being. The legislation we're proposing will make it clear that patients are entitled, if they choose, to have a voice in their medical care by speaking directly with those making those decisions about whether a new treatment or a new medication would be covered right from the start. It will allow them to provide the necessary information and context so that sound decisions can be made. Thank you very much.
Thank you, Senator. One of the issues, of course, that we have been very sensitive to in the last couple of years is the way in which changes in the Affordable Care Act at the federal level might impact coverage, access to coverage, and exposure to non-coverage, and it's the financial devastation of that at the state level. And we have begun to in the past, and will be continuing this year, looking at ways of protecting the Affordable Care Act at the state level. I'd like to introduce our Majority Leader, Senator Bob Duff, to talk about that in more detail.
Thank you, Senator. There's a saying that says if you don't learn from history, you're bound to repeat it. And a lot of times, before the Affordable Care Act, we forget the fact that there were limits on lifetime deductions, there were limits on the care that was out there, there were limits for people and how they can access health care. And while certainly we know that the Affordable Care Act is not perfect and could use some changes, as any major piece of legislation does, we want to make sure as a caucus that we are there to protect the Affordable Care Act here on the state level. It's been very important for our constituents across the state of Connecticut, and the fact that if you look at the polling, the Affordable Care Act has never actually been more popular now today than it ever has been. So we know in Connecticut 110,000 people buy coverage through Access Health Connecticut, our marketplace, 268,000 people that recover through ACA's expansion of Medicaid, about 14,000 adults, according to the Hartford Business Journal, those are under 26, would be kicked off their parents' plan if the Affordable Care Act were repealed. And premiums would skyrocket for over 500,000 adults, and over 1.2 million people in the state would be subject to the lifetime limits on coverage that is a result of the Affordable Care Act that would no longer be there. And we know that in Washington, unfortunately, with the administration at the White House, that there has been a constant attack on the Affordable Care Act since day one. On the day of the President's inauguration, he instituted an executive order to dismantle the Affordable Care Act to the extent that he could. In March of 2019, the Department of Justice asked the U.S. Court of Appeals for the Fifth Circuit to invalidate the entire Affordable Care Act, which would cause millions of people to lose their health coverage. In December of 2019, a federal district court judge sided with that group to strike it down, and in January, the Department of Justice urged the Supreme Court to delay consideration of the lawsuit only because that would increase the uncertainty for all Americans. So here we are at state level, wanting to do all that we can to protect the Affordable Care Act to the extent possible, to ensure that our constituents remain healthy, that we continue to be high on those health indices, to make sure that our children, our families, our seniors, and others are as healthy as possible, and that we are doing everything we can to support healthcare, not to undermine it for our constituents. Thank you.
Thanks, Bob. We also are very much aware that there's a great deal of overlap between issues related to health and issues related to the quality of our environment. And one of the key things that we're very much concerned about is, as we have been for years, protecting the environment in ways that avoid pollution of our air, our water, our land. And it's just been a hard-fought battle. So much money has been spent over the years to protect and purify Long Island Sound, many of our other waterways. But it's an ongoing battle. We have to be vigilant. And fortunately, we have an environment committee that is very sensitive to those issues, and also in relation to issues about access to utilities and the severe public health consequences that we know about that might happen were utilities to be shut off without reasonable due process in dire conditions. So to talk about some of those issues is our leader on issues of that kind, our chair of the Environment Committee, Senator Christine Cohen.
Thank you, Senator Looney, and thank you and Senator Duff for all of your leadership on these issues. I think we had a really great session last session, and I'm looking forward to gaining some bipartisan support going into the session, the short session, hopefully seeing some of these bills exit out of both chambers and ultimately being signed into law. Senator Lesser, I just want to touch on this. I already spoke about a public option for Connecticut. It's something that he and Representative Scanlon, as well as their ranking members of the Insurance Committee, worked so hard on last session, and I know that I join our other caucus members in our sentiments that we'd like to see that once again come forward in the short session and ultimately cross over that proverbial finish line. I've made no secret of the fact that prior to my Connecticut state health insurance, I was, as a small business owner, paying $1,500 a month in premiums with a $16,000 deductible. So if you do the math on that, I was paying over $30,000 a year before even seeing a benefit. And that is the case with so many across the state of Connecticut. That is pro-business legislation that helps the pocketbooks of our working families and ultimately inspires healthy competition within the insurance marketplace. It's something that I am passionate about, that I would like to see, and thanks to the hard work of Senator Lesser and Representative Scanlon, together with the governor's office, I'm hopeful that we can see that come to fruition. The Senate Democrats have recognized another hardship impacting people across the state, and that is utility shutoffs. Utility customers who fall behind on their bills are all too often not given enough time or information before their services are shut off, even in cases when they should be receiving protection from winter shutoffs. The annual number of shutoffs are going in the wrong direction, and I believe it was the Hartford Current who recently reported that in 2018, the number of shutoffs had more than doubled in northern Connecticut. We saw over 80,000 shutoffs, and only about 7,300 of those shutoffs were accounted for as hardship cases. So what that tells us is that there are likely many more eligible to be receiving hardship protection and thus avoiding winter shutoffs, but are simply not being informed of their options. Additionally, we are seeing the number of repayment arrangements on the decline between customers and utility companies. So again, those delinquent and unable to pay may not recognize that they have options. Conversely, many shutoffs have been not the product of a hardship at all. Many resulted in same-day reactivation of service, indicating that there may not have been an inability to pay, but rather an overlooking of a situation. So we know that in this day and age, most people have cellular service. Why not require utility companies to be texting their customers if shutoff is imminent? Reactivation fees are extremely costly, and utility companies are reaping the benefits of the same. Notification should certainly be reflective of the times. Notifications of process and procedure is now in the hands of the customers who are supposed to know the magic words to ask for these things, to know that they should call a utility company and say, I've fallen on hard times, or to know that they need to opt in to text notifications. The caucus here recognizes that utility shutoffs and improper notifications are impacting and are directly harming the families of Connecticut. We will introduce legislation requiring utility companies to notify customers of their hardship and low-income protection programs, countering the current system where customers must inquire about the program before being accepted. We will require text notifications to customers who are facing shutoff without the customer having to seek out receiving the same. Legislation may also direct utility companies to allow for payment arrangements in the event of back due bills and inform customers that such options are available to them. Another option which Senator Looney, caucus agenda item which Senator Looney mentioned is just as much a public health issue as well as an environment issue, and that is PFAS chemicals. Those are per and polyfluoroalkyl chemicals. And for those of you who don't know, these chemicals exist in a number of everyday items that we're using, from food packaging to furniture and rugs to nonstick cookware. But most importantly, perhaps, and as it pertains to Connecticut right now, is the use of PFAS chemicals in firefighting foam. We've had two such examples of spills of that nature in Connecticut from the firefighting foam since the last session, and the problems revolve around this aqueous film forming foam, AFFF, which contain high levels of PFAS. Governor Lamont, after the two incidents last year, established an interagency task force on the chemicals. We know that 11 states have taken some form of action on the matter, and 8 states have taken action to either restrict the use or completely ban the use of these firefighting foams containing PFAS chemicals. So the caucus intends to take action as well. We'll consider a number of recommendations that came out of the interagency task force, including establishing an AFFF take-back, reducing future emissions of PFAS chemicals by banning their use in training procedures used by firefighters, establishing a safe drinking water advisory council to make recommendations on the maximum contaminant levels allowed, and requiring all water bottlers selling bottled water in Connecticut to test their products for PFAS.
Thank you, Senator. Also want to thank Senator Kathy Austin, our distinguished chair of the Appropriations Committee, and Senator Julie Kushner, our outstanding chair of the Labor and Public Employees Committee, for being here today also in support of these caucus agenda items. And as I said, I hope will be broadly supported throughout the session. So we'll take questions at this time.
So can Senator Lesser tell me or explain exactly what the public option proposal that you're proposing is going to look like?
The short answer is no, but we'll be rolling that out as conversations with others that go forward. I think the important thing, last year Governor Lamont articulated what I thought was a bold vision of lowering health insurance costs by 20% for families and for small businesses across the state. And until we come up with a plan that does that, until there is broad consensus on, I think all options are on the table. The most common sense one that I can think of is people say, well, Senator Lesser, you've got great insurance and it's affordable. Why not let other people buy the same coverage that you have?
Will it be different from last year? I know you read into some roadblocks last year.
So there were a number of iterations of the bill from last year. There were different proposals that were on the table. I think what we're looking at is allowing people the opportunity to buy the same health care that we get, or a version of it. And if they get a better option right now through the private market, that's great. And if not, then that's fine. But the details, I think we are going to hold on at the moment. I think what I think is important is that we articulate the problem, which is that healthcare costs are too expensive, and that there are certain drivers of those costs. Prescription drugs, extremely high. We've also seen growth in provider costs. We've seen growth in insurance costs. And we're focused on bringing everybody to the table, making sure that we're articulating a bold vision of reform. And until that has been solved, we have a solution.
Well, regardless, Cigna's gonna tell you, or the insurance industry is gonna tell you, any public option is untenable to them. Any sort of ability for the public to buy a government-sponsored plan is untenable. So how do you get past that?
Well, believe it or not, we're elected by the voters and not by the insurance companies. And while I think we value their involvement in Connecticut and they're a major employer, the thing that I've heard, and I think the experts have agreed on, is that the cost of unaffordable health insurance is a tax on the economy as a whole. You heard from Senator Cohen a few minutes ago about the burden as a small business owner of having to pay. I think Christine, you know yourself. You can tell me much better than I can about the burden on small businesses and the tax that it has placed on the overall Connecticut economy. So if we're going to do something to help people in their pocketbooks, it's lowering health insurance costs. And I don't think that can wait another year.
I think that many of the this is not specifically for you, Senator, the insurance regulations that you adopt as state law don't apply to a lot of workers because a lot of workers don't have insurance. Their companies are self-insured and their benefits are administered by an insurance company. They think they have insurance, but they don't really. The companies pay it out of pocket, and these rules and laws that you're talking about don't apply to them. Isn't that accurate?
So you're absolutely right that there are self-insured plans covered by federal law called ERISA that the state does not regulate. And one of the things that I'm very interested in doing, in fact, I was speaking with the governor's office about this last night, is stabilizing the fully insured marketplace. Because the idea right now that there are small businesses in Connecticut that are self-insured, that scares the heck out of me. And if you know what your self-insurance is, that should scare the heck out of you, because one major claim can really affect an employer. So I think I believe in insurance. I think we can strengthen the insurance market. I think there are reforms that we're going to be looking at this year that will do just that.
Is the insurance industry at the table? You mentioned a lot of players are at the table, and also does the fact that this is an election year help? And this might be a popular political issue to push past the opposition.
We're talking to all stakeholders, but I'll tell you this: you look at the national conversation, what's happening in the presidential election. You've got on the far right of the Democratic field, you've got a public option, and then on the left, you've got folks pushing for single payer. The question right now isn't whether or not we need reform. The question is what kind of reform is best for Connecticut, and what's best for people across the state, and what's achievable. And I think we're willing to push the question and look at what we can do to provide real relief this year. And we're going to talk to all stakeholders as it goes forward.
Regarding the insulin, I was wondering, has the state of Connecticut ever regulated how much capped prices for any other drug or out-of-pocket expenses for any other medication? And how would it work? And would it apply to, like you were saying, companies that are self-insured?
We're gonna be rolling out. Representative Scanlon and I have been working on an insulin bill now for many months, and we're going to be rolling out the bill in the next few weeks. And I will tell you, it's not going to be one proposal. It's going to be a whole suite of proposals that are going to try to provide relief to people, because each sort of situation is a little bit unique. We can help people in one boat, but not in other folks. There are folks who have emergency need for insulin, but they can't get insulin from a pharmacist without going back to their doctor, and if they're in a crisis situation, they can die. There are a whole bunch of different folks who are in different positions. There are folks who are aging out, who are 26, who are now no longer covered by their parents' health plans. And so we're going to have a number of different components of this, but we are committed to the basic idea that nobody in Connecticut should die because they don't have access to insulin.
But have you done anything like this similar to any other?
I can't speak to the history of other proposals. I don't know. No.
Unique to be capping for one specific medication.
Certainly under the Affordable Care Act, there are all sorts of drugs that are now covered, that are required to be covered. This last year, we outlawed cost sharing on breast ultrasounds, for example. It's not a prescription drug, but it is a medical procedure. We do that all the time, where we say that we determine what the cost sharing should be with the patient.
Can someone explain exactly what you mean by telling your story to insurance companies, and what difference that's going to make? Because I can imagine a situation where it says, I'm very sick, my doctor says I need this, that's why I'm asking you guys for this, and they'll say, well, thank you very much, no, you can't have it. You know, I mean, what's the difference?
Obviously, it doesn't mean that your claim will immediately get accepted because you've had a chance to voice your opinion about it. But I think for anyone who's been in that situation, if you come at it from a place of denial, that now you're on the defensive and you have to convince them in your mind as to why you need this drug or this procedure, it's a very different position than to have from the very start to be able to say, here's my perspective, here's my background, here's what I think I would want you to know in making this decision. I think it just helps on both sides, honestly. It helps a person feel heard and understood a little bit, and I think it would lead to better decision making.
So, can I follow up on that, Paul? So already after you're denied, your doctor has a 30-day window to speak directly to the insurance provider on the denial of that claim. So what specifically would the patient be given then? Also
yes,
a 30-day?
That wouldn't change. A patient's allowed to do that wouldn't change. But what
would there be a time frame though?
And I think we haven't totally fleshed that out yet, but I imagine there would be. I don't think it can go, endlessly. But I think that even now, doctors are given a voice in the process with the insurance company. But there's many people who feel unheard about it. And just when I think about it, I think of the fact that you're really a consumer in this relationship. You've paid for a service. And so shouldn't you be allowed a voice right at the very beginning to say, here's the new medication I've been prescribed or the new treatment that I've been prescribed, and this is why I would really like you to consider accepting my claim.
And Senator Duff, could you explain what further protections that you guys have in mind? Because I believe at least in the Moy administration, there's 10 basic coverage areas were enshrined in state law. You point out in your materials here about the pre-existing conditions. So it seems there are already protections in state law. So I'm just wondering what additional ones you think might be necessary.
Yeah, I think that's a good question. I think we're looking, right now we're still at the concept phase. We're looking at what we could do to strengthen the ACA, as we did with the essential benefits a few years ago as well. So, and it all depends also on what the courts decide, because the courts could decide on lifetime limits. They could decide on various other pieces of the ACA that they may strike down, that we then could bring to Connecticut as something that we want to hold up and recognize as something as important for us that we could actually act on as a state level. So I think it remains to be seen. We have to watch these court cases very carefully. Again, as we know that we have hundreds of thousands of people covered under Access Health, and we literally, as Senator Cohen said, without the ACA, without good health coverage, people are spending tens of thousands of dollars out of their own pocket for basic health coverage. So this is such an important issue for our residents of having good health care coverage, and we want to do all that we can to lift up the benefits that are there and do what we can to protect that as a state.
So I don't see anything on here about a reinsurance waiver. Is Connecticut interested in applying for a reinsurance waiver, and is there an interest to put state budget dollars behind it versus using a part of premium?
The answer to the first part of the question is absolutely yes. We are actively pursuing reinsurance legislation, or legislation to establish a reinsurance program. That is something that has broad bipartisan agreement. I don't think we're ready yet to announce a funding mechanism, other than I would oppose, personally, I have concerns about efforts that would ask taxpayers of the state of Connecticut to subsidize insurance companies. That's not something that I would want to see move forward.
And Senator Lesser, all of you have made healthcare a priority for the upcoming session. Can you comment on any of the concerns regarding marijuana that we're seeing with some of these health studies? And does that change your debate over recreational marijuana going forward in this session?
Well, I'll let Senator Lesser and Senator Abrams comment on that also. But would like to point out that we do have medical marijuana already in the state. We're one of a number of states that have that. So already it's been demonstrated that marijuana is actually helpful for certain medical conditions. That's certainly not the case with tobacco. There's no such thing as healthful tobacco, and yet that's legal in our state. It's regulated by age. That's what we think that it should be with marijuana also. Our states, our neighboring states, are all in the process of either having or probably soon to adopt it. So it would seem that we would be like a holdout against the repeal of prohibition in 1933, were we to delay much longer in moving toward legalization of that.
Right, and I think that we're learning more about marijuana because more studies are being done than they haven't been. But do any of the recent concerns with people taking medication or heart defects concern you at all regarding recreational marijuana and legalizing it?
Well, I think that's why we need to regulate it, right? Right now it's available. It's available on the street in any community in Connecticut. You can also drive across the border to Massachusetts, and we've just heard from the governors of Rhode Island and New York are moving to legalize it this year, potentially New Jersey as well. It's available, and so the question is whether or not Connecticut's going to regulate it or not.
So what's the plan for tolls? I'll ask the question.
A toll? So we haven't even heard about tolls. No, obviously, there'll be a meeting this afternoon with the House and Senate Democratic leadership and the administration to try to finalize what we expect to be the details of the transportation bill. So we will try to get that done today, and then have language drafted by LCO that will reflect that agreement and try to get that ready within the next couple of days. It is our intent at this point to try to schedule a public hearing on the issue as well, and then proceed to try to schedule a vote. But this afternoon's meeting will be, I think, the one that's most important in trying to nail down details that currently exist in concept and but need to be reduced to statutory language.
Senator Looney, where do negotiations stand on a biennial bond package? Everybody's saying that's got to go hand in hand with tolls. Is that done? Do you have a tentative deal on that with the administration?
No, that is also, there are discussions on that moving in tandem at the same time. It is true that we want to see the Bond Act move at the same time the transportation bill does.
So do you still feel that there can be a public hearing and a General Assembly vote before February 5th?
I do. Obviously, everything would have to move pretty clearly like clockwork without anything going off the tracks, but I believe it's still possible.
So you would have to have a hearing next week and
Right.
possibly a session on the 3rd or the 4th.
Well, we haven't pinned down the final dates yet. It might be possible to have a session at the end of January. The thing that we are concerned about, obviously, since we're not in regular session and we are a part-time legislature, there are people who have other plans, and a vote of this kind is one that we don't want anyone to miss. So we have to schedule it at a time when we can get everyone here, and there are people that have other obligations. So I think both chambers have to do a careful head count on members' availability to try to thread the needle and get the exact date when we can get everybody here.
So is it possible it might slide to after February?
Well, I wouldn't speculate on that yet. We're trying to do our head count, because clearly on an issue of this kind, we don't want anyone to miss it in any way possible.
The
Well,
numbers are.
Is the governor going to be, I'm sorry, maybe is the governor going to be participating in these meetings, or is it going to be Democratic majority leaders and representatives of the governor's staff?
I believe it will be representatives of the governor's staff. I don't know whether he's planning to participate personally or not. I have spoken to a couple of the staff members who are planning to be there.
Do the numbers coming out of Rhode Island change this at all? The fact that their revenue projections are less than anticipated and expected on truck tolling only?
No, our plan is still just to have tolls on large trucks only on bridges. Nothing is affecting that. We think that is the way to move in order to secure revenues from those heavy trucks that provide the most wear on our roads, and it's also a way of capturing more revenue from out-of-state vehicles, which was one of the significant impetus to having tolls in the first place.
Okay, thanks, everybody.
Thank you.
Thank you.